Good morning, everyone. My name is Judith Enck. I am the former regional administrator for the Environmental Protection Agency, EPA, and I'm joined by Dr. David Bond, who is a professor at Bennington College. He is the associate director of the Center for the Advancement of Public Action at Bennington College. Also joined by Dr. Howard Freed, a physician. Dr. Freed is the former director of the Center for Environmental Health at the New York State Health Department. And we're also joined by Robert Chinnery in the back, who's an environmental engineer, the former assistant director at New York State Department of Health Center for Environmental Health, and also Dr. Zeke Bernstein, who is the Dean of Research, Planning, and Assessment at Bennington College. We are here today to announce a new community health questionnaire that starting today will be circulated in Hoosick Falls, New York, Petersburg, New York, and Bennington, Vermont. As I'm sure many of you know, the public water supplies and some private wells in all of these communities have been contaminated with the toxic chemical PFOA. PFOA is a fluorine-containing chemical that was used at manufacturing facilities in all of these communities. PFOA was used at the St. Gobain facility in Hoosick Falls, previously owned by Honeywell. The St. Gobain facility at McCaffrey Street is just 500 yards from the wells that the village of Hoosick Falls relied on to provide drinking water to thousands of their residents. PFOA was also used at the Taconic Plastics facility in Petersburg, and PFOA was used at the ChemFab plant in North Bennington, Vermont. PFOA biodegrades very slowly. It's very persistent in the environment. And just to illustrate its toxicity, 8 major companies that manufacture PFOA entered into a voluntary agreement with the EPA to stop manufacturing it effective December 2015. That is unusual for companies to acknowledge the environmental and public health risks of their chemicals to the point where they would stop using a particular chemical. Unfortunately, the main way people are exposed to PFOA is by drinking contaminated water or air inhalation. The chemical is absorbed after you consume or inhale it, and it accumulates primarily in a person's bloodstream, kidney, or liver. Even after all of this careful review by regulators and others over the last just recent memory, we do not know how long residents of Petersburg, Hoosick Falls, and Bennington consumed drinking water containing PFOA. Thankfully, all of the public water supplies and anyone with a private well who has requested this, they all now have carbon filters, which filter out the PFOA from the drinking water. I've spent some time in these communities, and the 2 questions that I hear the most are, first, is it safe to drink the water? And secondly, what has drinking the contaminated water for an unknown period of time, what has it done to my health and my family's health? I hear this a lot, particularly from parents of small children. Some of these little kids have only consumed drinking water with PFOA. So on the first question, if you're drinking filtered water and the filters are maintained, which is very important, it's okay to drink the water. I believe that these communities need an alternate water supply because we don't know how far the PFOA has migrated in the groundwater. I'm very concerned about drinking water coming from groundwater in these communities. We know that the PFOA moves quickly, but the regulatory agencies have not yet identified the contours of the underground groundwater, which is known as a plume. Some of you know that the federal Environmental Protection Agency recently announced Hoosick Falls will be added to the federal Superfund program, which is very good news for Hoosick Falls. New York State and Vermont state agencies have added some of these sites to state Superfund programs. But I want to point out that the Superfund statutes do not deal with health problems that individuals may be experiencing. Superfund is terrific at cleaning up the contamination of the past, getting to the root of the problem, but it does not deal with the health issues. So on the second question, what has drinking this water done to my health and my family's health? It's a fair question, and it's very complex. We're fortunate to have the findings of a multi-million-dollar study known as the C8 study that looked specifically at PFOA in drinking water in other states. And Dr. Howard Freed will discuss that study and its role in developing the questionnaire. So the goal of this community questionnaire is to determine, are there trends, health trends in these communities among the residents who consumed contaminated water? Whatever we find, we will share with the communities, we will share with local officials and regulators. We don't know what we're going to find, but if a trend is identified, it is our great hope that a more comprehensive health study will be done by either independent health experts, academics, health agencies to see if there are connections between this exposure and these illnesses. These sort of health studies take a lot of resources. This is not a health study that we're announcing today. We're announcing a very simple and important questionnaire that the residents themselves will be figuring out what's happened to their health. Our second goal in launching this new community health questionnaire is to encourage biomonitoring. Many people have had their blood tested for the presence of PFOA, and that is a good thing, so people know what the levels are in their own blood. And unfortunately, for many residents of Hoosick Falls and Petersburg, the levels came back significantly higher than what you would find in the general population. That testing, that blood testing, needs to happen again so people can compare what's happening in their own bodies after they've stopped drinking contaminated water. There are also other important biomonitoring programs that need to happen. The importance of this is if people know that they've got high levels of PFOA in their bodies, they and their physicians can be on the lookout for some of the illnesses that we're including in the questionnaire today. For instance, thyroid disease is one of the illnesses associated with PFOA exposure. It's pretty simple to test your thyroid hormone levels by a blood test, but your doctor needs to know that you were exposed and therefore do that sort of test that they may not ordinarily do. So it's very important that all the residents of these communities fill out the questionnaire, and the thing that we're most concerned about is reaching people who used to live in these communities but who've moved away. I've spoken to residents who grew up in Hoosick Falls who said the majority of the people they went to high school with, for instance, have moved away. So we will be reaching out to alumni associations, Facebook pages. We'll be using social media to get as many people as possible to fill out this questionnaire. The deadline is October 1st, and we are so grateful to have the leadership and the support of Bennington College in doing this. We could not do this without the professors and the students' support from Bennington College. So I really want to thank Dr. Zeke Bernstein, and it's now my pleasure to introduce Dr. David Bond, who will walk you through the questionnaire. And then we'll hear from Dr. Howard Freed, and then be happy to take any questions from the press.
Thank you, Judith, and thanks to everyone assembled here today, and thanks to the residents who've encouraged this project from the get-go. My name is David Bond, and I'm the Associate Director of the Center for the Advancement of Public Action at Bennington College. I'm also the recipient of 2 National Science Foundation grants to research the impact of PFOA in our region. NSF support has allowed Bennington College to open the doors of our science classroom to this unfolding environmental problem in real time. This has happened primarily in 2 ways. One, we've offered a new class on PFOA that reviews the chemical properties, environmental pathways, and policy concerns about PFOA today. We've opened this class to local residents free of charge. We've had high school teachers, local journalists, and nurses come in that want to get up to speed on PFOA, and we've opened that class to them. We've also taken small research teams of science faculty and science students out into the communities themselves and tried to produce original and independent data on PFOA contamination in conversation with the questions that communities are asking. We've learned a lot over the past year about PFOA contamination in our region. We've analyzed everything from maple syrup to kitchen faucets, looked at the stability of an initial reading over the course of a year, and done a number of sort of research into the questions communities have. One persistent concern that residents have told us that we've been unable to address up to this point is health concerns, as Judith said. I've been in hundreds of homes in Hoosick Falls and Petersburg and Bennington, and I've heard the question again and again. Residents have expressed frustration at the toxic uncertainty that PFOA has introduced into their lives. So many mothers and fathers have expressed fear and outrage that the homes they labored for years to call their own may have been quietly causing harm to their families all along. While taking water samples in the basement or chatting with residents over laboratory results about the PFOA levels in their water, I've heard the question again and again. How is PFOA impacting the health of my community? How is PFOA impacting my health? How will PFOA impact the health of my children? This questionnaire may not be able to answer those questions. It is not a formal epidemiological study, but it is a step in that direction. And it's a step towards marshaling the attention and resources that are required to adequately address those questions that the community are asking. So right now I want to sort of walk everyone through the survey itself, the questionnaire itself, what it consists of, how to access it, and why we think it's significant. The questionnaire consists of 10 straightforward questions that review exposure to PFOA and familiarity with 6 illnesses. And these illnesses are 6 illnesses that previous scientific study have correlated to exposure to PFOA. To access the questionnaire, we have it available in 2 ways. There'll be a paper copy at libraries and community centers in all 3 communities. But we're hoping most people will fill out the questionnaire online. To access the questionnaire online, you go to www.bennington.edu/PFOA. There'll be a very bold link at the top of that page that says PFOA Community Health Questionnaire. Click on that link, and it will open the questionnaire in a new window. The questionnaire takes about 3 minutes to fill out. We're hoping all current residents of Hoosick Falls, Petersburg, and Bennington will fill out the questionnaire. We're also hoping, as Judith said, that all former residents of these communities will fill out the questionnaire. We know a lot of people who grew up in these communities but have since moved away, and we're really hoping to sort of reach them and encourage them to fill out the questionnaire. This questionnaire does a few novel things. One, it aims to utilize the deep knowledge the community has of its own health. We want to take seriously what the community knows about its own health, and we want to give that knowledge greater prominence in some broader conversations about how to address and respond to PFOA contamination in our region. We'll also, as you've probably noticed, are bringing together 3 communities, Bennington in Vermont, and Petersburg and Hoosick Falls in New York. These 3 communities, over the last 50 or 60 years, have shared a very similar industrial history of plastics manufacturing. In the past few years, the environmental fallout of that industrial history has come into clear focus in each of those communities. Yet the response is often disjointed between those communities. One of the things we hope this questionnaire might help do is to begin to build bridges and start conversations across those communities. We think there's much to be gained by bringing these communities together. I do want to note that this questionnaire has undergone an extensive ethical review at Bennington College. The Institutional Review Board has reviewed and approved this questionnaire, and we have a number of safeguards in place to protect private information. The results, the general results, will be reported back to the communities, but all individual data will be kept confidential. As Judith said, residents have until October 1st to fill out the questionnaire. After October 1st, we will compile the results and report back to each community, as well as put together a formal report to release to the public about what we find. For those of you who are wondering what we might find with this questionnaire, not a formal epidemiological study, but a questionnaire, well, primarily we hope to find two things. One, we hope to provide additional clarity on emerging community health concerns. Individuals in the community are articulating a lot of concerns about some of these illnesses, and we want to sort of count how many incidents of these illnesses are in the community to provide some clarity to those concerns. And two, as I said earlier, we want to give greater prominence of the knowledge the community has of its own health. We want to raise the profile of that understanding and put it in conversation with wider conversations about investigations into PFOA and what to do about it going forward. If we notice any trends in the data, we will flag those and bring them to the attention of state officials and independent health researchers, and encourage those state officials and independent health researchers to bring the more substantive resources to bear on those trends to investigate them further. And with that, I want to hand it over to Dr. Howard Freed to talk more about the health issues. Thank you.
Thank you. Any discussion of the health effects of PFOA has to make reference to the C8 study. And that C8 study came out of litigation in West Virginia where there had been PFOA contamination. A panel of independent academic epidemiologists studied the medical literature and more than 65,000 people exposed to PFOA. It stands as the most comprehensive study, or one of the most comprehensive studies ever done on the health effects of any toxic chemical. It really is the gold standard for assessing the health risks of PFOA. The panel found links between PFOA exposure and kidney cancer, testicular cancer, ulcerative colitis, thyroid disease, severe high blood pressure in pregnancy, and high cholesterol. And it's those 6 illnesses that we are asking about in the questionnaire. So we are getting the help of the community in looking for these illnesses that have been linked, or known to be linked, to PFOA. And it will provide the most comprehensive picture to date of the PFOA-linked health conditions in these communities. The moniker C8 is a nickname for PFOA. They are the same thing. PFOA has 8 carbon atoms, hence the nickname C8 for this study. And with that, I think that we're probably ready for any questions.